At every turn, our healthcare system feels broken. Healthcare providers are working past the brink. Hospitals are crowded. Wait times are long. There are widespread drug shortages, burned out staff, and no clear answers on what's being done by all levels of government to try and help. Joining us this morning to share her thoughts about what needs to be done to fix these systemic issues is Dr. Rose Zacharias. She's the president of the Ontario Medical Association. Good to have you back.
Good morning, Anne-Marie.
Well, you're a doctor in Ontario, but we know these frustrations are shared right across the country. Let's start at the top. What should the federal government be doing to fix the crisis?
So the agreement in earlier days was that the federal government would always share 50% of provincial healthcare spending, and we are in a state of crisis after dealing with nearly 3 years of a global pandemic. We know there are investments that need to be made around doctor shortages, catching up on the backlog of care, and investments in home care and palliative care. And so we are calling on the federal government to increase their Canada Health Transfer from the 22% where it's at right now to 35%. We need investments around these shortfalls in our system.
Well, this is where things seem to be stuck or at a stalemate, because Canada's premiers have met 3 times since July to talk healthcare. As you say, they want a $28 billion increase to the Canada Health Transfers from the federal government, something a lot of doctors like yourself back up. But last night, the federal health minister said it's the provinces who are holding up this deal. The prime minister adding they don't just want to write a check. They want to know the plan from the provinces before they give more money. What could the provinces be doing on their own to ease the burden in the system?
So the provinces do have some room to move. We need to license internationally trained doctors. This is something we've been speaking to our provincial government about. About 100 physicians went to Queen's Park just a few weeks ago and met with MPPs. I've been meeting with the health minister, and we're talking about this specifically. Practice-ready assessments, working with our college regulator. If this was in place, our proposal would see hundreds of new doctors in our system by the spring.
Is there anything more that can be done, Dr. Zacharias, on a municipal or at a hospital board level?
Hospitals are overwhelmed. I'm very proud of my colleagues coming into the hospital each day and working inside a system that is nearly at the brink. And so we have a commitment to work with our hospitals. We have consulted our external stakeholders like hospitals, like all of the allied healthcare professionals. And together we're calling on an increase in the federal government transfer. And so our alignment, I think, speaks volumes. And it's there. I recently penned a letter with all of the presidents of the provincial and territorial medical associations. We are aligned and asking for more money.
What happens if governments at all levels don't step in?
So I've been an emergency room doctor for 20 years, and honestly, I don't ever remember being in such a state of crisis. Never did I think we would be closing emergency department doors. We know also that nearly 2 million people in Ontario don't have a family doctor, and so this lack of access to primary care is not just putting strain on this system, but it's putting strain on people and their families and parents and their children. And as doctors inside the province, we want to deliver really good care, to build that trusted relationship with our patients. But we need some help, and we need investments in the system to do so.
Dr. Zacharias, great to hear from you today. Thanks so much for your time this morning.
Thank you so much.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.